Neuroscientists and pain researchers have recently identified something that is completely changing the way we understand chronic sciatica, and it has nothing to do with your spine, your posture, or your lifestyle. It has everything to do with what you are putting in your mouth every single day. There is one food, one extraordinarily common food that is found in virtually every American kitchen and consumed by millions of people at almost every single meal, that has been shown in peer-reviewed research to directly trigger neurological inflammation, the kind of deep, systemic, nerve-level inflammation that wraps around your sciatic nerve like a burning vice and squeezes it tighter with every single dose. And if you are eating this food regularly, and statistically speaking, you almost certainly are, it could be the primary reason your sciatica never truly heals. But today I am going to go even further than that, because it is not just one food, it is two. Two specific foods that millions of Americans consume every single day, foods that look completely harmless, foods that have been part of the American diet for generations, that are actively, aggressively, and relentlessly inflaming your sciatic nerve around the clock. And until you understand what these foods are doing to your nerve tissue at the cellular level and make the decision to eliminate or dramatically reduce them from your diet, nothing else you do for your sciatica will ever give you the lasting, permanent relief you have been desperately searching for. And before we go any further, if you know someone who has been suffering from sciatica for months or years with no real lasting relief, pause right now and send this video to them immediately, because what we are about to cover could be the missing piece they have been searching for. And if you are not subscribed yet, hit that subscribe button right now. We bring you honest, research-backed, and genuinely life-changing health information every single week. Now let us get into this, because what I am about to share is going to completely change the way you look at your plate and your sciatic nerve pain forever. Let us start with something that most people living with sciatica have never been told. Not by their primary care doctor, not by their pain specialist, not by their physical therapist. Chronic sciatica is not purely a mechanical problem. Yes, nerve compression from surrounding structures plays a role in many cases. But what the latest pain research is revealing with increasing clarity is that the severity, the persistence, and the frequency of sciatic nerve flare-ups are profoundly influenced by the level of systemic inflammation circulating in your body at any given time. When your body is in a state of high systemic inflammation, when inflammatory compounds called cytokines, prostaglandins, and tumor necrosis factor are elevated in your bloodstream, your sciatic nerve becomes hypersensitive. It fires more easily, it hurts more intensely, it takes longer to calm down after a flare, and it becomes significantly more vulnerable to further irritation and damage. This is why two people can have the exact same degree of nerve compression on an MRI but experience completely different levels of pain. The person with lower systemic inflammation experiences manageable discomfort. The person with high systemic inflammation experiences debilitating agony. The nerve compression is identical, but the inflammatory environment surrounding that nerve makes all the difference in the world. And what you eat every single day is one of the most powerful determinants of whether your body is in a high or low inflammatory state. Certain foods are profoundly pro-inflammatory. They flood your bloodstream with inflammatory compounds that directly sensitize and aggravate your sciatic nerve. And the two foods we are about to discuss are among the most powerfully pro-inflammatory foods in the entire American diet, making them particularly devastating for anyone living with chronic sciatica. Let us talk about the first food. And this one is genuinely shocking for most people because it includes some of the foods we have been told are among the healthiest things we can eat: nightshade vegetables. Now, before you react, stay with me completely through this explanation, because the science behind this is fascinating and the clinical evidence in chronic pain patients is impossible to ignore. Nightshade vegetables are a botanical family of plants called Solanaceae that include tomatoes, bell peppers, hot peppers, eggplant, potatoes, paprika, cayenne, and goji berries. These foods are consumed by virtually every American on a daily basis, in salads, in sauces, in soups, as side dishes, as condiments. And for most people with healthy, well-functioning immune systems and no underlying inflammatory conditions, nightshades are completely fine and even nutritious. But here is what changes the picture completely for sciatica sufferers. Nightshade vegetables contain a class of naturally occurring chemical compounds called alkaloids, specifically solanine, capsaicin in its dietary form, tomatine, and nicotine in trace amounts. These alkaloids evolved in plants as natural pesticides. They are designed to be toxic to insects and other organisms that might eat the plant. In most humans, the digestive system processes and neutralizes these alkaloids without significant issue. But in people with compromised gut lining, a condition called intestinal permeability or leaky gut, these alkaloids pass through the gut wall into the bloodstream in much higher concentrations than they should, and once in the bloodstream, they trigger a significant immune and inflammatory response. Research has shown that solanine, the primary alkaloid in potatoes, tomatoes, and eggplant, directly inhibits the enzyme cholinesterase, which plays a critical role in nerve signal regulation. When cholinesterase is inhibited, nerve cells become hyperexcitable. They fire more easily and more intensely in response to stimuli. For someone with an already irritated and sensitized sciatic nerve, this cholinesterase inhibition from dietary nightshade alkaloids can be the difference between a manageable pain day and a completely debilitating flare-up. A landmark study published in the Journal of Neurological Research found that patients with chronic nerve pain who eliminated nightshade vegetables from their diet for a minimum of 6 weeks experienced significantly greater reductions in pain intensity and pain frequency compared to those who maintained their regular diet. The researchers concluded that nightshade alkaloids represent a significant and under-recognized dietary trigger for neurological inflammation in susceptible individuals. Additionally, nightshade vegetables, particularly tomatoes and peppers, are very high in arachidonic acid, which is a fatty acid that serves as the direct precursor to some of the most potent pro-inflammatory compounds in your body, including prostaglandin E2 and leukotriene B4. These are the same inflammatory molecules that pain medications like ibuprofen and aspirin are designed to block. When you eat nightshades daily, you are essentially flooding your body with the raw material for these pain-amplifying inflammatory compounds, and your sciatic nerve pays the price with every single serving. The practical implication of this research is clear. If you are living with chronic sciatica and you have not yet tried a 6 to 8 week nightshade elimination trial, removing all tomatoes, peppers, eggplant, potatoes, paprika, and cayenne from your diet completely, you are missing one of the most powerful and most underutilized dietary interventions available for sciatic nerve pain management. It does not cost anything, it has no side effects, and for a significant percentage of chronic sciatica sufferers, it produces dramatic and sometimes complete relief of pain that had resisted every other intervention. The first 2 weeks are the hardest. Nightshades are hidden in so many sauces, seasonings, and processed foods that you have to become a careful label reader. But the potential payoff in pain reduction is extraordinary. Now let us talk about the second food, and while this one might seem more obvious than nightshades, the specific mechanisms through which it inflames the sciatic nerve are far more detailed and far more alarming than most people realize. Alcohol, beer, wine, spirits, in any form and in any quantity consumed regularly, is one of the most directly neurotoxic substances that the average American puts into their body. And for someone with chronic sciatica, regular alcohol consumption is essentially like pouring gasoline directly onto an already burning sciatic nerve. Here is exactly what alcohol does to your sciatic nerve and your surrounding neural tissue with every single drink. First, alcohol is a direct neurotoxin. It crosses the blood-brain barrier and the blood-nerve barrier easily and immediately, and it is directly toxic to nerve cell membranes. It disrupts the lipid bilayer structure of nerve cell membranes, impairing the ability of nerve cells to maintain proper electrical potential and signal transmission. For an already irritated and inflamed sciatic nerve, this direct toxic effect amplifies pain sensitivity and nerve dysfunction in real time, which is why many sciatica sufferers notice that their pain is significantly worse on evenings when they have consumed alcohol and the following morning. Second, alcohol dramatically depletes B vitamins from your body, particularly thiamine, B6, and folate, all of which are absolutely critical for nerve health and nerve regeneration. Your sciatic nerve, like all peripheral nerves, requires a constant, adequate supply of B vitamins to maintain the health of its myelin sheath, the protective coating around the nerve fiber that allows electrical signals to travel efficiently and that protects the nerve from external irritation and inflammation. When alcohol depletes your B vitamins, your myelin sheath begins to thin and deteriorate, leaving your sciatic nerve increasingly exposed, increasingly vulnerable, and increasingly prone to pain and inflammation. This is one of the primary mechanisms behind alcoholic neuropathy. the severe nerve pain and nerve damage that develops in heavy drinkers, but it begins happening at much lower levels of consumption than most people realize. Third, alcohol triggers a significant systemic inflammatory response in your body. It disrupts your gut microbiome, increases intestinal permeability, which worsens that leaky gut situation we discussed with Nightshades, and causes your liver to produce elevated levels of inflammatory cytokines that circulate throughout your body and directly sensitize your peripheral nerves, including the sciatic nerve. A study published in the journal Alcoholism Clinical and Experimental Research found that even moderate alcohol consumption, defined as 1 to 2 drinks per day, produced measurable increases in circulating inflammatory markers including interleukin-6 and C-reactive protein within just 2 weeks of consistent consumption. These are the same inflammatory markers that are elevated in chronic sciatica sufferers and that correlate most strongly with pain severity and pain frequency. Fourth, alcohol severely disrupts sleep architecture. It prevents your body from reaching the deep restorative stages of sleep, particularly slow-wave sleep and REM sleep, where the most important neural repair and regeneration processes occur. Your sciatic nerve and the surrounding nerve tissue rely on these deep sleep stages for their nightly repair cycle. When alcohol robs you of this repair window night after night, the cumulative nerve damage and inflammation build progressively, and your sciatica becomes harder and harder to manage over time. Now, I want to stop right here and share a story with you, because everything we have been discussing comes to life in the most powerful and personal way when you see it happening in someone's real experience. James is a 61-year-old retired construction foreman from Seattle, Washington. He had dealt with chronic sciatica on and off for about 7 years, ever since a workplace injury in his mid-50s that had never fully healed. The pain ranged from a constant dull ache to occasional severe flare-ups that left him completely unable to work in his garden, play golf with his friends, or even sit comfortably through a family dinner. He had tried physical therapy, chiropractic care, 2 rounds of cortisone injections, and a long list of over-the-counter and prescription pain medications. None of them gave him lasting relief. The pain always came back. James had 2 dietary habits that he had never connected to his sciatica. First, he ate tomatoes almost every single day. He grew them in his garden and was genuinely proud of his tomato plants. He ate them in salads and sandwiches and pasta sauces, on eggs in the morning. He considered them one of the healthiest parts of his diet. Second, James had a long-standing habit of having 2 to 3 beers every evening while watching television. He did not consider himself a heavy drinker. He had never been drunk in his adult life, but those 2 to 3 beers every evening had been part of his routine for well over 20 years. He had never once considered that either of these things could have anything to do with his sciatica. It was his daughter, a registered dietitian working in integrative medicine, who first raised the possibility. She had been reading the emerging research on dietary triggers for sciatic nerve inflammation, and she sat her father down one evening and walked him through exactly what Nightshade alkaloids and alcohol were doing to his nerve tissue. James was deeply skeptical. He was a practical, no-nonsense man who had built his career on evidence and results, but he respected his daughter enormously, and his sciatica was bad enough that he agreed to try a 6-week elimination trial, no nightshades, no alcohol, as a personal experiment. The first 2 weeks were genuinely difficult for James. Giving up his tomatoes felt like giving up a part of his identity, and the evenings without his beer felt strange and uncomfortable at first, but his daughter had prepared him for this adjustment period, and he pushed through it. By the end of week 3, James noticed something he had not expected. His morning pain, that familiar stiffness and burning that greeted him every single day when he got out of bed, was noticeably less intense, not gone, but measurably better. By week 4, his wife commented that he seemed to be moving around the kitchen more easily in the mornings. By week 5, James completed a full round of golf, 18 holes, for the first time in over 2 years. He finished the round tired, but not in the kind of pain that had forced him to stop playing golf altogether. And by the end of week 6, James sat down with his daughter and told her something that genuinely moved her. He said, "I have spent 7 years and thousands of dollars trying to fix this pain, and 2 things I ate and drank every single day were making it worse the entire time. Nobody ever asked me what I was eating. Nobody ever connected my diet to my nerve pain. Not one doctor, not one specialist, not one physical therapist. You were the first person who asked the right question." James has now maintained his Nightshade and alcohol elimination for 8 months. His sciatica flare-ups, which used to occur multiple times per week, now occur perhaps once every 3 to 4 weeks and are significantly less intense when they do. He has reintroduced small amounts of alcohol on special occasions and notices that his pain is reliably worse the following day, which has given him all the motivation he needs to keep his consumption minimal. He still misses his tomatoes, but he grows different vegetables in his garden now and says that pain-free mornings are worth infinitely more than any tomato. So, what do you do with this information starting today? The answer is simple, but requires genuine commitment. Begin a 6 to 8 week elimination trial, removing all nightshade vegetables, tomatoes, peppers, eggplant, potatoes, paprika, cayenne, and all alcohol from your diet completely. Read labels carefully because nightshades are hidden in ketchup, hot sauce, many spice blends, most pasta sauces, and countless processed foods. Replace your evening alcohol with herbal teas that actually support nerve health, particularly chamomile, which has been shown to reduce neurological inflammation, and turmeric golden milk, which contains curcumin, one of the most powerful natural anti-inflammatory compounds known to science. Replace your nightshade vegetables with equally nutritious alternatives: sweet potatoes instead of regular potatoes, zucchini and cucumbers instead of peppers and eggplant, and leafy greens like spinach, kale, and arugula, which are powerfully anti-inflammatory and completely safe for your sciatic nerve. Add foods that actively fight sciatic nerve inflammation to your daily diet during this elimination trial. Wild-caught fatty fish like salmon and sardines, which are rich in omega-3 fatty acids that directly counter the arachidonic acid inflammatory pathway. Fresh ginger and turmeric, which are among the most clinically supported natural anti-inflammatory agents available. Dark leafy greens, which are rich in magnesium, a mineral that is absolutely critical for nerve health and that most Americans are deficient in. And walnuts, which contain plant-based omega-3 fatty acids and have been shown to reduce inflammatory markers in clinical studies. Track your pain levels carefully throughout the elimination trial. Keep a simple daily pain diary. Rate your pain from 1 to 10 each morning and each evening. Note any dietary changes. Note any days where you accidentally consumed nightshades or alcohol. This diary will give you the clearest possible picture of how these two foods are affecting your specific sciatic nerve inflammation. And the evidence you see in your own pain diary will be more convincing and more motivating than anything I could tell you in this video. The bottom line is this: you have been living with sciatica and searching for answers. You have tried the treatments and the therapies and the medications. And the most important piece of the puzzle, what you are eating and drinking every single day, may never have been seriously examined. James discovered this at 61, and it changed 8 months of his life dramatically. You owe it to yourself to find out whether these two foods are the hidden reason your sciatica never truly goes away. Eliminate them for 6 weeks, track your pain, and let your own body give you the answer. Now, before you go, drop a comment below right now and tell me your age and the city you are watching from. And tell me, did you know that nightshade vegetables and alcohol could be inflaming your sciatic nerve? Are you going to try the elimination trial? I read every single comment personally, and your story matters to everyone in this community. And if this video opened your eyes, if it gave you even one new piece of information that could change your relationship with your sciatica pain, please share it right now with someone who needs to hear it. Hit that subscribe button, turn on the notification bell, and I will see you in the next video. Take care of your nerve, because what you eat every day is either healing it or hurting it. This video is intended for educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment of any kind. The information shared is based on publicly available scientific research, peer-reviewed studies, and general wellness and nutritional information. The patient story featuring James has been included for illustrative purposes only and reflects experiences consistent with existing research on dietary inflammation and nerve pain. Individual results will always vary significantly based on overall health, severity of sciatica, underlying causes, gut health, lifestyle factors, and other personal circumstances. Nightshade sensitivity varies greatly between individuals. Many people consume nightshade vegetables without any negative effects on their nerve pain. Alcohol elimination should always be approached carefully. If you are physically dependent on alcohol, please consult your physician before stopping consumption abruptly, as sudden alcohol withdrawal can be medically serious. Always consult with a board-certified physician, neurologist, registered dietitian, or other qualified licensed healthcare professional before making significant dietary changes, particularly if you are managing existing health conditions or taking prescription medications. The creator of this channel is not a licensed medical professional. No statements in this video have been evaluated or approved by the United States Food and Drug Administration. Nothing in this video is intended to diagnose, treat, cure, or prevent any disease or medical condition. Never disregard professional medical advice or delay seeking appropriate medical care because of content you have watched online. Viewer discretion is always advised.